This conference will now be recorded.
Hi, everybody. Thanks for joining us. I'm Luann Fortune with Saybrook University in the College of Integrative Medicine and Health Sciences. And I am delighted to be here today with my dean, Dr. Don Moss, who is the Dean of the College of Integrative Medicine and Health Sciences. And I've had the honor of working with Don for the past 8 years. I know him as an incredibly generative scholar and practitioner, and his many contributions even outside of Saybrook, in particular in the area of clinical psychotherapy, biofeedback, clinical hypnosis. Don's been a past president of APA Chapter 30. He's very active in an organization called SESH, and he, along with Angele McGrady, are authors of a very important book called Integrative Pathways. So Don, thank you so much for joining us today. Is there anything you'd like to add to the credentials that I've mentioned?
Thank you, Luann. I think that's enough about me, and I actually want to talk about my work with my collaborator, Angele McGrady. I think this is important for students to hear because so much of the work that gets done in healthcare today is collaborative work. I don't think Angele and I ever realized the collaboration we were moving into in the beginning. I utilized her often when I was the editor of the Biofeedback magazine. She contributed articles for the magazine, often on her research on diabetes, the use of self-regulation strategies, biofeedback, efforts to predict which students would, or which patients would respond positively to behavioral interventions. But around the year 1999, Angele and I began to dialogue about a book which became the Handbook of Mind-Body Medicine for Primary Care. We actually had 4 editors. I was the lead editor and she was the second editor. And that collaboration has continued for 2 decades. Around 2012, she began talking about a concept called pathways. And that led to our first book, which came out in 2013, Pathways to Illness, Pathways to Health. And then more recently, a second book, Integrative Pathways, which came out in 2018. And I'll tell you, the collaboration has been rich. It means it's a personal friendship, but also professional sharing. Angele is professor of physiology in the Department of Psychiatry at the University of Toledo. And as you know, my background is in psychology, health psychology, and psychophysiology. So we bring together complementary skills. Her original concept for the Pathways series was to recognize how many lifestyle factors and behavioral choices human beings make. We adapt certain lifestyles, we adopt certain lifestyles, we make certain behavioral choices, and suddenly we're ill. These lifestyle factors include things like cigarette smoking, our sleep habits, our level of aerobic activity or lack of aerobic activity, how much alcohol we use, the foods we choose to put in our body, the stress we expose ourselves to, and whether or not we learn stress management coping strategies. So many of the illnesses that bring people frequently to medical clinics, such as hypertension, diabetes, cardiovascular illness, are a direct effect of these kinds of choices and lifestyle factors. So we were interested in developing a way to integrate lifestyle changes, more positive behavioral choices with professional treatment. And this led to our first Pathways book, the Pathways to Illness, in which we highlighted how is it that human beings make choices that lead to illness, and what can we do to intervene to help people make personal choices, to initiate goals, and actually implement those goals to make behavioral choices before we even begin professional treatment. Now, I mentioned Angele contributed the emphasis on lifestyle. I contributed an emphasis on self-care, locus of control, and self-efficacy. It's so important. The research on self-efficacy shows that when human beings actually feel like they're involved in generating a choice, they're much more likely to implement that choice. And if we can help people set a small goal for a change in sleep pattern, a change in how much they walk to a nearby park, or how much they they think about their choices of food in the course of a week. And if those small choices begin to actually generate increases in energy, improvements in mood, reductions in the level of pain, suddenly we have a patient who believes I can make changes in my behavior, and this will make a difference in my overall health. Some professionally delivered therapies also are very good for building self-efficacy. Luann mentioned that I'm involved with both biofeedback and hypnosis. When somebody learns to relax their musculature with biofeedback and they can see the change on the computer display, suddenly they have more faith. I can do something and it actually impacts my physiology. Or when I do hypnosis, I do a hypnotic induction, and I show on the biofeedback screen, the computer screen, your EEG just changed. That high level of trauma and anxiety that you were showing on your EEG was just erased as you went into hypnotic induction. People have a dramatic conversion into self-care. They suddenly believe these things I can do will make a difference. One other, I think, background insight that went into the Pathways series. That is, I work in a beautiful part of the world. I live on a sand dune in a forest across the street from Lake Michigan. We have beautiful beaches and you can walk for 10 miles uninterrupted. We have boardwalks along the rivers. There are greenways with boardwalks and bicycle paths. And yet I worked in the 1970s and 80s in community mental health clinics in this area. And it was not unusual for me to find out my patients didn't know where Lake Michigan was. They had never walked a beach. They had never walked the boardwalks along the channel or the river. They rarely left their homes. If people live in a box and the windows aren't even open, they're going to be depressed and they're going to be sick. So Angele and I decided to develop a framework in which we would bring together a number of treatments, not just one alternative treatment or one integrative therapy, but a variety of personal choices, behavioral choices, lifestyle changes, acquiring skills, and then putting that together with professional treatment.
Mm-hmm. So, Don, the Pathways model clearly has implications for supporting individual wellness and well-being. How do you see it being applied in clinical settings in healthcare? And in particular, right now, with the current crisis we're dealing with in healthcare globally, what are the opportunities for the Pathways model to help promote a better level of wellness?
Well, I've been thinking about this a lot, Luann. Obviously, we're all touched by COVID-19. And I was going to give a lecture last night for Cliff Smythe's class on meditation. So I thought about it and I thought, I started out before all of my work in healthcare as an existentialist. And one of the early existentialists was a German philosopher named Karl Jaspers. And he wrote about limit situations. These are situations where we come into a confrontation with the wholeness of life and with ourselves. Our usual busyness with everyday routines is gone. And suddenly we're confronted with, where am I in this life? And I have to make choices. Well, I think COVID-19 is doing that for human beings, and it's global. We're aware it's Tom Hanks in Australia. You've mentioned a relative in Slovenia. It's people all over the world. Our usual lives are suspended. We're not spending time in cafes, bistros, restaurants. We can think about, what can I do with my path? And the Pathways model is a good one because level 1 focuses what small behavioral changes can I engage in a self-directed way? What can I do about my level of activity? What can I do about my sleep patterns, the time I get into bed? What can I do about the activities I engage in the evening as I approach sleep? Um, what can I do if I can't get to the gym? What can I do to remain active? So self-directed behavioral